The Center for Communication and Social Impact is a social behavior change organization that has been working for about a decade now. And we have expertise in social and behavior change for health and social development. And then we also have expertise in brand management and media advocacy. Now, on this particular investment for COVID, we are working closely with the partner, Nigerian Health Watch, and together we are taking forward the deliverables as has been highlighted previously by Olufunke. So the principles that shape this engagement include applying the science, being flexible, being agile in the support, definitely building capacity on the go, innovating and documenting. We take inclusiveness seriously, and has been mentioned also, we support context-based adaptations. Also trying to connect the dots, knowing that communication is actually cross-cutting. And most importantly, we work together to ensure there is a seamless partner integration to avoid duplication. So at this point, I actually do want to recognize the responsive leadership of Dr. Disu and his members of staff on the risk comms team, and also the versatile and robust partnership that we are privileged to work with. So for the support at national and state level, the areas of interest include partner coordination, strategy formulation, so the strategy for the risk and risk communication and community engagement space of work. We supported the finalization of that document, of course, working closely with all the partners who had actually started that good work. Message curation and development, which of course includes content development, concept designs, deciding which channels is best for what, and again, making sure that they are context specific at the end of the day. Working closely with Nigeria Health Watch, we actually do a lot of work in the space of documentation, story writing, interviews at national and state level, looking at partners across the space of demand and supply, people working at the health facilities, the health workers themselves, people who are actually affected by the pandemic, and other partners in this response. Capacity building is also key, and then also one key thing for the work we do is actually the core of what we're doing is making sure that science guides our work and looking at the EPPM model to gather the insights from the communities and the audiences, and then we actually did embark on a risk diagnosis study. I'll talk about that later. Next slide. So how did our support evolve? So the message needs definitely have changed, and I'm sure you'll all agree with me that the guidelines have been changing, and it's okay for the guidelines to change, as one of the previous speakers have alluded. So take a case in point, even being the change in case definition. So we've gone from generic messaging, talking about what COVID is, talking about why people should take it seriously, talking about the signs and what to do if you do have any of the symptoms, to topic-specific messaging, issues around priority behaviors, protective behaviors, also to issue-specific messaging like addressing stigma or other things that do come up based on the science. And then we've moved definitely away from the generic messaging, message for all, to audience-specific messaging. Again, this is shaped by the results of the perception polls and some of the findings. And again, taking that a little bit further, we've also been able to embark on sector or seasonal specific messages, like messages for the Salah period. And definitely, most importantly, messages to counter myths and misconceptions, and also some of the events that evolve as the pandemic is shaping. For example, when lockdown was eased, of course, the behaviors needed to be highlighted and some stressed, and again, when travel restrictions were lifted. Next slide, please. So in addition to changing the message, of course, you know, the messengers have also changed over the period. And as the previous speaker said, the messenger is equally, even if not more important than the message, equally important. So we've started from working with the government authorities, you know, establishing the NCDC, the PTF, that's the task force, and the Federal Ministry of Health has established authorities to give messages to the public just for them to have confidence in those messages, and moved from there to personality of the experts. So experts in the health space, experts in epidemiology, experts in demand generation, experts in risk comms, experts in different shapes of the aspects of the response. So like I was saying, the messengers have evolved over time so that we can actually make sure that our messages are streamlined with the phase of the epidemic, with the emerging issues and what surveys or findings are throwing up. So like I said, even ordinary men and women in the community, young people, and then we've also been able to send messages through peer groups, for example, messages for the artisans through representatives of that community. In addition to what has evolved, the formats of the messaging definitely have evolved, from the conventional discussion dialogues to announcements to animations to using print media, stories from the field, testimonials. But I'm going to talk a little bit more on the last two, which is endorsements, and this is using the voice of the people that matter and especially infusing entertainment education. So that sounds a little bit funny, right? But yeah, really, in some of the recent messages that we've done, we found that infusion of humor actually does really work. So the topics the messages have covered, this has been mentioned already by Dr. Disu: stigma, wearing of the face mask, asymptomatic nature of the COVID. And these topics are thrown up based on the findings from the research and from the survey. Yeah, so all the work that has been done has actually been to make sure that the flagship campaign, which is the Take Responsibility campaign, is better streamlined. When the response initially started, it appeared as if the Take Responsibility as a flagship campaign seemed a little bit generic, but with the infusion of science and with the evolution of the campaign, we've been able to add specific taglines that made them better streamlined and resonate better with each audience. So for example, for young people, take responsibility. What you do today might affect how your elderly loved one is or is not affected by COVID. Take responsibility. If that travel is not necessary or is not important, you can cancel it. Over the past few weeks, I've been working closely with NCDC, the Risk Comms team, and the partners. We've been able to support the production of, like Awele said, we've definitely done lots of materials and lots of jingles, right? So radio spots, definitely over 100. But the beauty of the deliverables that this investment has been able to support is that it's quite inclusive. So we've also been able to go outside the conventional messaging to make products for the deaf, to make products for the visually impaired. And because of our principles of making sure that gender is mainstreamed, it has an inclusive approach from the outset. We've been sensitive in how we've applied behavioral insights to make sure that the content of those messages, the design of those messages are able to actually address the sensitivities that the ordinary message will probably have not really thought about. So some of the messages have definitely cut across the education, the different sectors. Like Dr. Disu said, is a multi-sectorial response. So the beauty of communication at that level, at state and subnational and national, is that we're able to apply our expertise and experience to support the different sectors, so education, and any other one that really does come up. This slide Dr. Disu had actually shared before, so I won't waste too much time about it. But the issue is that as at the time this study was conducted about 3 or 4 weeks ago, majority of the population, about 60%, were actually in that red box, which is where you don't want anybody to be when you're trying to address a national response. And in that box, they have low threat and low efficacy. And you know, when they're in that box, they are so confused, they don't know what to do, and then they're in that shade of denial. So in taking the findings from this survey forward, can we have the next slide? Then we decided to take an examination of the current messages, and then we designed new messages to try and actually appraise the levels of threat and the levels of efficacy, knowing, as has been said before by Dr. Disu and in previous presentations, you want to build the confidence of the audience to be able to actually take action. So the findings actually revealed that the messages are taken at different level. How they are perceived by different groups, they do vary based on where they are, who they are, and the context where they're speaking from. And in addition to that, it was found out that for the 3 key protective behaviors of hand washing, social distance, physical distancing, and wearing a face mask, one of them was actually a bit difficult to practice, and of course your guess is as good as mine. It's the one that actually requires a structural adjustment. It's the one that requires a change in the social mindset, and it's of course the one that is alien to our culture, so to speak, in Nigeria: physical distancing. Next slide, please. So what we did with the results of some of these findings was then to go back to the drawing board. Can I have the next slide? Was to go back to the drawing board and see how we could better raise the threat level or adjust the threat level and in the same manner give them a commensurate level of confidence for them to actually be able to undertake the appropriate or recommended behaviors. So in the last few minutes or last few seconds I want to deliberate a little bit on the cross-cutting recommendations. And the beauty of these recommendations is that you can actually apply them outside a pandemic situation. So they can be taken as generic recommendations in terms of messaging going forward, especially if your strategy is underpinned by the extended parallel processing model, which we all know has the two main legs of threat and efficacy. And if you want to look at the level of threat and the level of efficacy, you just want to put your audience in a space where they are able to take the recommended behavior irrespective of their context. So for the first recommendation, constructs and formats of the messages actually are very important. So you want to consider where is the content or the design of your message, is it implicit versus being explicit? Are you looking at the unconventional message designs? Are you doing the same conversational dialogue if it's a radio spot? Or are you doing something different? And then we also found out that messages that are actually asking the audience to directly role play a behavior have been known to actually perform well in terms of their perception of risk and their ability to do something. So we then rolled out the Be Like, let me use my name as an example, Be Like Funke series. Funke is a hairdresser. She makes sure her customer wears her mask. She makes sure that they are physically distancing just to protect themselves from COVID. So in doing this, you're trying as much as possible to balance the threat and to balance the efficacy, making sure that you're not throwing your audience into panic, but you're encouraging them to do the right thing. In addition, we definitely were able to then design messages that could counter the viral themes. And so instead of just keeping quiet or just pretending as if those things don't exist, for example, I'm sure you all know the Do You Know Somebody series. So we had some of the messages that actually directly counteracted that, of course using the entertainment education format, and that actually worked very well. And then definitely another thing that we found out is that you might want to choose carefully the words you use, because words that also drive rejection might also have a relationship with raising the level of panic. And then messages based on how easy the action you're asking the audience to do should probably be considered a priority. So it's easier to wear a face mask than it probably is to physically distance. And then lastly, use of local language, that definitely is a key recommendation going forward, so that your messages are actually context specific. So overall, CCSI has been able to deploy all this expertise, working with its group army of over 5,000 volunteers in more than 18 states to make sure that this message gets down to the grassroots. For lack of time, I'm going to stop here. And then if you have any questions, thank you.